Welcome to today's webinar on the proposed Intrastate Funding Formula update. I am Anna Grazia from the California Department of Aging. Before we begin, I'd like to share a few brief housekeeping items. This webinar is being recorded. A recording of this webinar and presentation will be made publicly available later this week on our CDA website. Live ASL interpreting and automated captioning are also available today. All participants will be muted during the presentation, but if you have a question, please submit it to the Q&A box. We will address questions during the Q&A session following the presentation. You may also send questions or comments to ca2030@aging.ca.gov. That's ca2030@aging.ca.gov. With that, I will now turn it over to our director, Susan DeMorris.
Thank you, Anne, and welcome to all of the participants joining us today and to everyone who will be watching this after today with our recording. So thank you all for taking time out of your busy schedules to join us for a Learn at Lunch about the proposed Intrastate Funding Formula. Today, we expect to have individuals who know the formula inside out, area agencies on aging, and other partners who have been engaged in this dialogue for years. We also expect to have joining us people who have heard things here and there and are rounding out their knowledge. And we also know that there are people joining us today who may not have any exposure to the Intrastate Funding Formula. You are our target audience. We want to make sure that everyone who joins us today leaves this webinar knowing where we've been, where we are today, and where we're going with California's Intrastate Funding Formula. So that's what we'll be talking about. Next slide, please. I want to start with a slide that's familiar to many people who are joining us today and many people who are represented in this slide if you're an older adult joining us. This is a slide that was produced with data from the California Department of Finance, and it shows that as a state, we're experiencing significant growth among the older adult population. In fact, we're already well underway with this explosive growth, and you will see from this slide that as Californians age, the numbers increase. So we're looking at 17%, 12%, and then we reach the ages of 80 and above, 131% and more, triple-digit growth in California's older adult population. Next slide, please. The last slide showed statewide growth among the older adult population. This slide shows where that growth is happening. It's divided up into regions of our state, and it goes back to 1980. It also has a fairly recent touch point in the middle column of 2020, and it projects out to the year 2060. You'll see that in our state, the fastest growing rate of growth as a percentage is in the Sacramento area, where we will experience over 500% growth between 1980 and 2060. And every region of our state is experiencing growth in the 60 plus population. Next slide. Against this backdrop, I wanted to share with you what's happening nationally. So while our population in California and across the country is growing rapidly and changing dramatically, we haven't seen investments in the Federal Older Americans Act proportionate to this growth. This slide from one of our partners, Monami, shows that the population on the top graph is growing nationwide by 24%, and we've seen relatively flat funding for the Older Americans Act. And that's what we're talking about today, primarily as our source of funding for California's area agencies on aging. Next slide. These changing demographics, as you saw from the prior slides, they started years ago, and we've been talking about this for over a decade about the surge in population among the older adults. Our governor, Gavin Newsom, got ahead of this when he first took office nearly 8 years ago, when he established California's Master Plan for Aging, a 10-year blueprint for our state to plan for this growth. The legislature joined with Governor Newsom and passed Senate Bill 228 by Hannah Beth Jackson, and that bill codified the Master Plan for Aging in our state statute. California then released its Master Plan for Aging in January of 2021. We're now in the 5th year of this 10-year blueprint for our state. And every year there have been initiatives related to the Master Plan for Aging that address the aging network and how we can strengthen capacity and build infrastructure statewide. Starting in 2022, CDA led the California 2030 Stakeholder Initiative. You'll hear more about that shortly. And about 2 years ago, I think it was, two or three, the Federal Administration for Community Living adopted the Older Americans Act final rule. In 2024, the legislature passed and the governor signed Senate Bill 1249, Roth, Modernizing the Aging Network, and just this past September, California's 2025-2029 State Plan on Aging was approved by the Federal Administration for Community Living. These initiatives and efforts and rules and legislation address the changing demographics in our state, and they propose changes in policy to support a growing older adult population. Next slide. I mentioned the California 2030 initiative that CDA led, and I want to thank our partners who joined in that effort. The California Association of Area Agencies on Aging, the California Commission on Aging, the California State Association of Counties, the County Welfare Directors Association, and the California Foundation for Independent Living Centers. I want to thank the leadership from those organizations as well as their members who gave over a year of their time to meet and discuss the future of California's aging network. Next slide. So this is the timeline that is before us. The California 2030 group, as I just mentioned, launched in 2022. They conducted research, including interviews, focus groups, surveys throughout the year in 2023. In spring of 2024, they released their final recommendations. In fall of 2024, Senate Bill 1249 was passed. In the summer of 2025, we began work on implementing California 2030 and Senate Bill 1249. And we're now in a 4-year cycle, 2025 to 2029, to fully implement all of these recommendations and policy changes and statutory changes for implementation, full implementation in July of 2029. Next slide. Following the stakeholder work in California 2030, the Senate Bill 1249 was introduced and was signed into law, and that stakeholder work helped prepare the foundation for Senate Bill 1249. Our stakeholders worked on 6 areas: funding, that's what we're talking about today, geography and demographics, local governance, branding and communications, programs and services, and performance measures. All of this work flowed into Senate Bill 1249 and has informed our current implementation priorities, including core AAA services, planning and service area and area agency on aging designations, and updates to the Intrastate Funding Formula, the topic we're discussing today. Next slide. As mentioned, the Senate Bill 1249 was signed into law in 2024. The California Commission on Aging, with technical assistance from the California Department of Aging and the Aging Network, sponsored Senate Bill 1249, and it focused on three areas: defining core AAA programs and services, clarifying PSA and AAA designations and de-designations, and updating the IFF. Next slide. This walks all of us through the phases that have led to today. In the far left column, we talk about the engagement that happened with our California 2030 Steering Committee. They met 10 times. We held individual interviews with each of the state's 33 area agencies on aging. We conducted key informant interviews with 80 state, local, and national subject matter experts. We held 5 public webinars, and we conducted the state's first ever consumer survey with 17,700 older adults responding. That then influenced and informed Senate Bill 1249, which was signed into law. And upon enactment, we embarked on our implementation strategy. We kicked that off with a half-day workshop with the California Association for Area Agencies on Aging and their AAA members. We then held 9 webinars for AAAs and partner organizations. We conducted 4 topical surveys with all 33 AAAs. We created a funding calculator that we released to the AAA network so they could model any changes to the formula themselves. And then we continue with quarterly SB 1249 implementation meetings. We've held 2 so far this year, and we have another one scheduled in June, I believe. Next slide. It is now my pleasure to turn the program over to our Chief Deputy Director, Nicole Shimosaka. Welcome, Nicole.
Thank you very much, Director, and thank you everyone who is taking their lunch hour to be here with us. Very excited to share with you the work that has gone into this effort thus far, what's led us here today, and where we are going next. Next slide, please. I want to start with just some fundamental, foundational items so that we can all be sure that we're talking about the same thing here together today. For folks who are maybe not so familiar with this work, AAA is an acronym you're going to hear a lot. That is our Area Agencies on Aging. So those are the entities that receive the funding from the department. A planning and service area is a PSA, and that's the geographical region that a AAA covers. So a PSA could be one county or it could be several counties. We have both modeled here in the state. CDA is what's referred to as the State Unit on Aging, and that is a title that we have because we allocate the Older Americans Act funding for the state of California. Every state has a State Unit on Aging that has this responsibility. And then lastly, you're going to hear the term area plan. An area plan has to do with the Title III Older American Act funds and the plan for those dollars in the local communities. We refer to the contract that we provide to the AAAs, the area agencies, as the area plan contract. And local area plans are part of the planning efforts that go into assessing an area, the local need, and how the funding will be used at the local level. So first and foremost, the Intrastate Funding Formula. What is it? The Intrastate Funding Formula is unique to the state of California, as it is unique to every state across the nation. Every state has the autonomy to determine their own intrastate funding formula for how they will allocate Older American Act dollars. Many states have their own sets of factors and weights that they've determined in conjunction with their AAAs. California is at a place where it's time we do the same. We are expected to review the formula periodically to ensure that greatest need is being targeted for these funds. Greatest need is a term that is routinely seen throughout the Older Americans Act to identify those with the greatest social and economic need to ensure that these finite funds are getting to where they are needed most. The Intrastate Funding Formula supports several different services and programs, but they can be bucketed into 5 categories: supportive services, congregate nutrition, home delivered meals, preventative health, and family caregiver services. So in short, the Interstate Funding Formula is California's unique formula by which we allocate Title III funds to the AAAs. Next slide, please. There are several reasons that we are updating the formula now, and we've compiled some of those here. The last time this formula was reviewed was 30 years ago. Since then, new data has been made available, demographics have shifted dramatically, and we haven't in earnest identified the greatest social and economic need being targeted in this formula since the last iteration. So it was high time that we did this review and we ensure that the dollars are reaching the communities that need them most. In the subsequent slides, you'll see that our current formula is extremely complex and convoluted and frankly confusing. So it's time in an era of program integrity, in an era of transparency, that we simplify the formula and we really have one set of factors and weights that we use to identify our priorities as a state and ensure we are reaching the greatest social and economic needs. We want to do this now to help with planning at the local level. The next area plan cycle will be here before we know it. They are 4-year planning cycles. We want to provide ample time for the AAAs to have knowledge and awareness of any changes so that they can make those changes locally as well. Lastly, there's compliance that we need to be mindful of. Senate Bill 1249 calls on the department by this September to review and propose updates to the formula. Additionally, our federal oversight entity, the Administration for Community Living, also known as ACL, has asked that the state review the funding formula because it has been 30 years since we've done so. So there's a variety of reasons for us to do this, but the most significant reason would be to ensure that we are still targeting those with the greatest social and economic needs in the state. Next slide, please. The new proposed IF is designed to reflect current needs and conditions across the state. We want to do this equitably by distributing these finite funds where they are needed most. We want to align the allocations with updated policy and program priorities as demonstrated with including a disability factor for the first time in the formula's history. And we also want to ensure that we are targeting the areas of the greatest need. The factors that we agreed upon in working very closely with the area agencies on aging are 60+ age factor, a low income factor of 200% of the federal poverty level, including a disability factor, which aligns the aging and disability intersectionality that is very, very important we include in this body of work. We have a race and ethnicity factor, and we have a geographic isolation factor. It's very important to note that both race and ethnicity and geographic isolation are required by the Older Americans Act. You can see here in the charts that we have listed, on the left-hand side, we have this very complex and confusing set of rules based upon federal funds or state funds. So our federal funds are weighted and factored using the farthest left column. Our state factors currently are weighted and factored using that middle column, and we're proposing that we simplify all of this. So every single dollar is allocated using the same factors and weights. Unintentionally, because the current factors and weights are so complicated and there's different rules for different funds, and there's two hold harmless levels included, inadvertently, the thing most prominently weighted in the formula today is just the sheer number of adults age 60 plus, which does not actually demonstrate the greatest social and economic need. There are areas within the state that really need and benefit from older American Act dollars, and there are areas in the state that are more prosperous. So we need to be sure that we're not just counting the sheer number of individuals, but we are really truly looking at need. By using low income, racial, ethnic minority, individuals with a disability, and geographic isolation, we are targeting the individuals that need this funding most, and we're doing it equitably with these 20% weights across the board. Next slide, please. As you can see with this slide here, we are demonstrating that there is not just one area of the state that we are targeting with these factors and weights, but there is a vast contrast between rural areas and urban areas being represented with the factors. This formula and the updates were not determined by, an area that we wanted to see funding going to, or there was no backing into this. We started with the factors, working closely with the area agencies on aging through surveys and through a calculator model to determine what is the greatest representation of need. Settled on these 5 factors because, as you've seen with the previous the existing formula, when you get too many factors in there, it gets convoluted and they start to cancel one another out. These factors are a true representation of need. They have reputable nationwide data sources, and these demonstrate our priorities here in the state of California. And as you can see, there is a representation of them throughout the state in the highest concentrations that you'll see in the top part of the chart here. Next slide, please. There are special rural considerations that we need to be mindful of to include within the formula. Not only does the Older Americans Act require a rural minimum expenditure rate, which in plain language means we have to ensure that there's a baseline amount of rural funding being provided to our rural partners. The Older Californians Act also requires a rural factor. So it's very important that we continue to represent this within the formula as we move forward and we continue to uplift the rural areas. Next slide, please. This is a chart that many of you have already seen. We've reworked it a little bit, so we've broken it out into 2 charts, and it is available on the CDA website. The reason for breaking it out into 2 charts is because it was just getting too tiny. We wanted it to be very legible for everybody who wanted to review it, but with so much information and so many rows, it was getting challenging. The current allocations, as you can see there, are from 24-25, and we intend to continue to update these allocations on an annual basis so you can see projections of how the allocations might change with these proposed factors and weights. The next column is that the proposed allocations. And then the following 2 are the difference and the percent of change. The percent of change can really differ from entity to entity, just based upon what their current budget is. Some areas might see a 30% increase, and for others, that might equate to only a 5% increase. So it's very subjective, and it's important that you look at the raw dollars as well. For totality and understanding impact, we've included a 3-year average of unspent funds, which is the 4th column from the right. And that just shows how much funding is returned to CDA on an annual basis and then reallocated as carryover dollars. Funding returned to CDA does not get lost. It does get reallocated out to the network as carryover. we have a column of the total proposed allocation. So out of 100% of the allocation, you can see how much is being allocated to each area, and then how much of the 60 plus population that area has to correlate how much funding they are receiving to how much of the population they have. The very last column is our hold harmless amount. And when you think of a hold harmless, you can think of it just as a baseline of funding. We've included a year 21-22 hold harmless. This was based on feedback from the area agencies along with our research. We chose 21-22 because that was about halfway through the midpoint of our nutrition increases that we saw year over year during COVID. We wanted to be sure that there was a strong baseline of programmatic funding without negating the impacts of the formula. If we bring the hold harmless too close to current year, the formula really will be less impactful because because allocations don't change so prominently year over year. So 21-22 was a nice middle ground to provide that baseline programmatic funding while still allowing the factors and weights to play a role. It's important to note the limitations of the current allocations and the current formula. The current allocations have two hold harmlesses at play. One is from 84-85, that's fiscal year 84-85, and one's from fiscal year 1999 and 2000. Because of how the formula is structured and the rigid rules of that formula, there are some entities that are brought up to hold harmless, and then they are no longer qualified for any additional funding. There are other entities that are artificially inflated well beyond what they need in their area because of those hold harmlesses. As demographics have changed and we've been held to these rigid numbers from the 80s and from 1999, we haven't been able to, the formula hasn't been able to right size itself due to these rigid rules. And so there are some that are harmed by the formula today, and then there are others that received inflated funding that could be better served elsewhere. So it's really important that we acknowledge there are weaknesses in the current formula and limitations, unintended consequences, because the formula wasn't meant to continue to rely on numbers from 40 plus years ago. Next slide, please. Now this is very, very small, and I don't expect anybody to be able to read this as it's on the screen right now, but it's on the CDA website, and I see that it's getting dropped into the chat as well. This is the allocations by county. So this is, again, every AAA oversees a planning and service area. So a AAA can oversee a geography of 1, 2, 3 plus counties. So if you took it on a county by county basis, this is a breakdown of how much funding that county would receive today and how much they would receive with the proposed allocations. This is important because a bigger body of work at play here is the entirety of the CA 2030 work that is embodied in Senate Bill 1249. There is the county right of first refusal that is coming into play, where counties can choose to reclaim their area agency. If they were to do so, these counties need to know how much funding they're working with. This graphic here would show you that. Now, of course, these allocations are based on the idea that there's 58 counties interested in taking over their area agency, which is not something that we are tracking nor advocating for. But we wanted to provide a baseline understanding for all areas to understand how much funding might be available should they choose to reclaim their area agency. Here is another feature of the formula that was created in conjunction with the area agencies on aging. Something we have routinely heard is that there is not enough administrative base funding. The cost of doing business and the cost of staff have increased. So what we are proposing within this formula as a direct result of the feedback we've heard is a $250,000 base administrative funding. Ideally, this would be $150,000 in federal funds and $100,000 in state funds. Now there's a finite number of state funds available, 3.3 million. Thank you to the legislature for that augmentation a few years back. So if there were more AAAs, we might maybe see, 80,000 in state and 170 in federal. But the idea is no matter what, we are proposing a $250,000 base funding. The language that was provided to the legislature in the trailer bill language allows flexibility for us to continue to review and augment this in the years to come. We know the cost of business continues to rise. By creating a hard-coded number within the code or statute, it makes it very, very challenging for CDA to meet these rising needs. By having language in there that is more flexible, we're able to continue to work with our partners to continue to review this amount and determine if it's sufficient or if we need to revisit and potentially increase this in the future. Next slide, please. Here are the various areas of the area plan contract or the Title III and Title VII funds that would be impacted by this formula. So we have the Older Americans Act administrative funding that we just discussed. We have Title III excluding the long-term care ombudsman, which has its own formula. So we would not be impacting the formula that's already codified for long-term care ombudsman, but the other areas of Title III would be impacted. That's the supportive services, congregate nutrition, home delivered meals, preventative health and family caregiver. Title VII elder abuse would also fall into these factors and weights. The state general fund, which is required for match, the state and the locals both have a share of match that they are responsible for Older American Act funds. We would allocate the match based on the factors and weights, and we would allocate something called surplus overmatch. Right now today, in the simplest of terms, surplus overmatch is money above and beyond what is required for match. So much of the nutrition funds that we've received over the last several years are considered surplus overmatch. In the current formula, due to how complicated and complex it is, these dollars are not allocated as equitably as they could be across the state. By revisiting and including these funds along with all other funds listed on the screen in the same formula of factors and weights, we are more equitably distributing the funding where it is needed most. We oftentimes as well use these factors and weights for new initiatives in the future. So in strong budget times when new work is upon us, we would like to use these factors and weights to allocate that funding as well. Next slide. And these are the areas that you will not see the formula impact allocations. Title V, which is our Senior Community Service Employment Program. Title VII Ombudsman, which, as I said, has its own formula. Health Insurance Counseling and Advocacy Program, along with the Medicare Improvement for Patients and Providers Act funding. Our State General Fund, Aging and Disability Resource Connection funding, and the Caregiver Resource Centers. All of these programs have a formula separate and distinct from the Intrastate Funding Formula, and we will continue to use the formulas that they have and will not include them in this change. There are several guardrails and safeguards that we have included within the formula in response to a lot of the feedback that we've received from the network and in coordination with the area agencies on aging to ensure that there is time to be thoughtful around any changes. First and foremost is that 21-22 hold harmless that I shared with you all. Again, we chose that year because it provides a concrete level of base funding without negating the impacts of the formula. We're choosing a 2-year phase-in process, and so you get 50% in 1 year, and then it'll be 100% the next year, to allow for any ramp up or ramp down in services, any changing in contracts, or any mitigating of impacts that might unfold as we make these changes for the first time in 30 years. There's planning time before the implementation, again, speaking to those local area plans and wanting to be sure local autonomy remains strong to make the best decisions for the needs within local communities. And we're including additional supports, such as the base administrative funding that I shared with you all, the $250,000 for admin funding as a base. And then the proposed federal carryover policy, which is an accountability measure we do not have currently today. Next slide, please. Something we heard loud and clear from our partners was that there needs to be accountability for unspent funds, and we need to be sure that these dollars are reaching communities that have the capability to expend them. Right now, today, the current formula provides 5% of unspent funds back to the AAA, regardless of spending. If you spend, 80%, or if you spend 10% of your funds, you will get 5% to retain. Then the rest of the funding goes into the pot and is allocated out to everyone. This new measure requires that you spend 90% of your funding, or you do not receive carryover at all that fiscal year. So for the first time ever, we are going to require high expenditure rates to ensure that funding is going back into the communities that have proven they have the means to expend it. So we're doing away with everybody gets 5% and then they get to share the rest. And we're moving towards, if you spent 90%, you are qualified for what is unspent across the network. We would allocate carryover using the factors and weights, the same as the original formula. Those 5 factors and weights will remain constant throughout, and we will pool together what's unspent, determine the partners that spent 90% or more, and then we will allocate using the factors and the weights. And this will be an accountability measure that has been long requested by many of the partners that we finally have an opportunity to implement. Next slide, please. Using basic math, we can go ahead and review the proposed allocations and what is generally remaining on the table year over year from each of our partners. You can review and see if the given areas are at that 90% spend rate. And this is another reason to really be very thoughtful about the timing here. For areas that are not targeting that 90% expenditure rate, we want to give them time in order to reach their maximum capabilities in spending and the funding. And for areas that are expending that, we want to give them time to adjust to the idea that they might receive more carryover than they have in the past. So we want to be very, very thoughtful and allow that time for planning, allow that time for tightening up internal controls, tightening up contracts and services, and ensuring our partners are spending 90% of the funding provided to them and that they have the means and capabilities to expend their original allocation and carryover. This is phase, oh gosh, we're in phase many of many right now. We are about halfway through all of this very vital work that we've begun. We're probably about 2 years in on the work of the Intrastate Funding Formula updates, reaching this place of a proposal to provide to the legislature. We're moving through the budget process with the proposed trailer bill language in the May revise. Once the trailer bill language is adopted, we will move into the public rulemaking phase, which is begins the public regulations process. As many of you are aware, as we've begun regulation work in other areas of the department, this comes with an additional public comment phase, and it comes with the opportunity for hearings, so you can voice your feedback as well for inclusion in the decision-making of the department. We would not implement the updated formula until July 1st of 2029. So we've done the work leading up to this point, which was much stakeholder engagement, interviews, calculator modeling, iterating, updates to proposed allocations and making sure that we were getting our priorities right and in alignment with the area agencies on aging. And now we're moving into a phase where we're ready to move this into statute and begin the regulatory work to enforce the formula. Next slide, please. I have shared a lot about what the formula is. I think it's important to be equally clear about what it is not. This intrastate funding formula is not directed at any one county, any one region, any one entity. This is a formula that is informed by the factors and weights that we've decided upon based upon our priorities here in the state of California. We've used 5 factors to determine the greatest social and economic needs, so it's not based upon one single metric. There is not a statewide funding cut, and this is not being fully implemented until year 2031 due to that phase-in process. There is not a withdrawal of support for aging services, but rather the direct opposite of that, wanting to reinforce and support the network in advance of 2030, when 1 in 4 adults will be over the age of 60. This is our opportunity to be thoughtful and purposeful in ensuring funding is getting where it is needed most to support the most vulnerable members of our society. This is not a change to local control over any service planning, and we stand firmly in maintaining that autonomy at the local level. And this is not, unfortunately, intended to cover the full unmet need in any one community. This is a finite number of dollars and it is not caseload or workload driven. So we need to ensure that these funds are getting into the communities and into the areas where the older adults need them most. Next slide. What will not change is our support. We'll continue supporting and championing older adults, people with disabilities, and family caregivers. We're committed all the way through to strengthening the aging network on all fronts. Funding is one aspect of this, but there are many bodies of work included in CA 2030 equally important. We want to continue to provide that local autonomy to the AAAs, the PSAs, and their subcontractors to determine what services are most needed in the community and how to prioritize those local needs within their area plans every 4 years. And we want to continue to uplift local leaders to give voices to the needs within their communities. Next slide, please. This is a slide some of you have seen before, and it shows a lot of work underway, and we'll just dive into it just a little bit. But there's 3 major streams of workload that were outlined in Senate Bill 1249, shown here on this visual. First, we have statewide services. Then we have the designation work, which you heard me refer to as the county right of first refusal. And we have the funding formula that I'm discussing here today. You can see that this work began in 2025, and here we are halfway through 2026, continuing the engagement and continuing the conversation to advance this work before 2030. We're continuing to engage on the future IF allocations, the carryover policy, base funding, and we're continuing to work through the budget process in order to get this new proposed IF in statute. This complements the work that's being done in the designation with a lot of the regulatory changes and the public hearings that some of you have partaken in. And it further complements the statewide services and introducing new performance measures to ensure our partners understand the expectations and understand the level of care that we want all of the clients to receive at the local level, regardless of where they live. Next slide, please. We want to continue to do public engagement and continue to maintain our transparency on all of these bodies of work, not just the funding. So you can continue to use the CA 2030 at aging.ca.gov inbox for any feedback that you have on this topic. We recently embarked on a public comment period that was required by the Administration for Community Living, and we generated over 250 responses. I see that there is some Q&A on today's webinar, and as soon as I'm finished with this portion of the segment, we will move on to those questions. Anything that's not answered live today, we will do a subsequent FAQ to follow up. And then lastly, we're right in the midst, right in the thick of it. So as we move forward with these statutory changes, we will then begin the public regulation process, which comes with its own set of public comment and public hearing opportunities. I strongly encourage you to visit the CDA website and to review the materials on there because they're vast. There's quite a few different resources you can tap into, including a variety of webinars. And then as always, if there's ever any questions, you can use that CA 2030 inbox listed above. Next slide, please. And I fully appreciate that this is a lot of information for a noontime meeting. So if there's nothing else that you take away today, please know that it's been 30 years since we've updated the Intrastate Funding Formula. And not only do we need to comply with state and federal law, we need to ensure that we are targeting those individuals with the greatest social and economic need across the state. We need to ensure that the IF is updated to align with population trends. The demographic changes have been vast, and we need to ensure that our state's priorities are uplifted and reflected in the formula. We've done extensive engagement with the Aging Network for several years now. I know I personally have worked on this over the last 2 years, and it's been extremely rewarding opportunity to understand the lived experience and the work happening at the local levels and be able to use this process to respond to the feedback that we were provided and incorporate those ideas into the formula to reflect not only that we understood, but we support the Aging Network and we want to make a formula that works for them. And lastly, 21 of the 33 area agencies will see an increase. That encompasses 46 counties across our state would see an increase with this proposed IF model. Next slide, please. This will be published on our website later today. If you have an opportunity, I believe it just was dropped in the chat. If you have an opportunity to download this, here are other resources that you can review to better understand this body of work. And I want to thank everyone for taking the time. We do have about 12 minutes for Q&A.
All right. So first question we have is about the slides. Yes, we will be posting these slides to our website. The next question is, has the new IF been used for the fiscal year 26-27 budget?
It has not. The new intrastate funding formula will not go into effect until fiscal year 29-30, and then there will be a 2-year phase-in period where only 50% of any increase or decrease would be recognized at first.
All right, next question. Federal poverty guidelines are very low when you consider cost of living in the Bay Area counties. Has there been any consideration in utilizing economic measure to identify low-income populations like Elder Index?
Yes, we have reviewed several different low-income measurements, if you will. We arrived at the 200% of the federal poverty level because that was one that was championed in the surveys provided by the area agencies on aging, prominent in our feedback. But yes, we did review several data points for that as well.
Right. Was there a trailer bill submitted for this budget cycle?
It was submitted, correct, and it was released in the May revise, just about a week and a half ago. So it was just recently released, yes.
Next question. Does each PSA get to decide what areas to spend their funds?
Each PSA has autonomy within the guidelines of the Older Americans Act funds. So those 5 buckets that I spoke to earlier, supportive services, congregate nutrition, home delivered meals, preventative health, and family caregiver, Each AAA is allocated funds within those 5 buckets, and then they have the discretion for how they will budget those funds.
Right. Next question is about the 3-year unspent funding, asking how is it calculated? Does the calculation include state funds that have a 2-year fiscal year lifespan? Does it apply only to Older Americans Act funding, and does it include COVID?
Thank you. The 3-year unspent funds are only Older Americans Act funds, Title III funds, not including any increases that we saw during COVID, and it does not include the state general funds that have a 2-year lifespan. It is purely the federal funds provided by the Older Americans Act.
Right. Next question. Why are the 5 factors weighted equally at 20%?
This was a determination made in collaboration with the area agencies on aging to ensure that all priorities identified within the state were weighted equally across the board. It strongly received feedback, and the department agrees that low income, disability, rural, one does not take precedence over the other. They need to be weighted equally for consideration as we identify greatest need.
Right, next question. Please clarify, how will the new IFF impact the long-term care ombudsman programs?
There are several formulas that go into the long-term care ombudsman programs. Some of those are codified within the W&I code. So within the slide, I did identify that elder abuse prevention funding would fall into the updated proposed IF, but the Title VII ombudsman funds would continue to be allocated using the formula that is been codified already. They would not be impacted, and that is within the slide if you'd like to revisit.
Right, next question. If we're seeing the sharpest increase in those 75 plus, why are we starting the weighted factor at 60 plus?
We have opted to start at 60 plus because lifespans will older adults continue to live longer and longer, and we wanted to be ensure that we captured all older adults over the age of 60 because that's the age at which Older American Act funds have become active for older adults. That's the age at which you can start to receive the services. So we did toy with starting at 75. We've seen other states include an 85 factor, but we wanted to be sure that we captured the full spectrum of older adults that could benefit from these.
All right, a question asking if the network can get a further breakdown of the current and proposed program allocations by bucket for each county. So,
Go on, Andy.
so it's asking if right now we're just demonstrating administrative dollars and program dollars. I think the question is asking if we could provide something that gives the breakout of each bucket of funds.
I'm sure that we can review those. We are going to update the formula fairly soon for 25-26, and then the new data set that is available, that is something that we could certainly look at to further expand everyone's knowledge and include that transparency.
All right, a couple more. Were service providers included in this decision-making process?
We intentionally worked very, very closely with the California Association of Area Agencies on Aging and the Area Agencies on Aging as our first line of communication and collaboration, because we wanted to be sure that a formula that was going to impact them was reflective of the work that we did together. So much of this work up till now has been in collaboration between the department and between the AAAs. Intentionally so, because we wanted to be sure that we were encompassing their feedback as to help guide us to the decisions that we've made here.
And last question we have, oh, that was answered. I think everything's been answered now.
Thank you. And we will continue to go through the comments as well to see if there's any that we can pull out to add to our existing FAQ as well. I want to thank everyone for taking their lunch hour to be here with us today. I hope this was informative, and if you have any additional questions, please email the CA 2030 inbox, and we'd be happy to break down any items that you'd like further clarification or understanding of. Thank you, everyone.